Bill, how are you today? It's nice to see you again. So I brought you back today for your 3-month diabetes follow-up visit.
I'm pretty sure I thought I wasn't diabetic.
With your last A1C levels, you were pre-diabetic. Do you remember what an A1C level is?
No, can you remind me, please?
Okay, Bill, let's start from the beginning. When a person with a normal functioning pancreas eats food, it is broken down into carbohydrates and then further into sugars. The pancreas will release insulin from something called beta cells. The insulin breaks down the carbohydrates into sugars, and the sugars are used for energy in muscle cells. When a person becomes insulin resistant, pre-diabetic or diabetic, the sugars cannot be utilized for energy properly and just build up inside your blood.
Oh yeah, that's right.
So, do you remember when you first started to come see me and we checked your sugars every few years? That's because your pancreas and insulin were functioning normally, your weight was under control, you were exercising every day, and you weren't smoking. Since then, some of your lifestyle habits have changed and your body has become insulin resistant.
Yeah, you did warn me about smoking too much, along with keeping my blood pressure and weight under control. Is this my mom and dad's fault? They both are overweight and diabetic.
Yes, all of those things are correct. While genes from your parents may play a part in your diabetes, so does your lifestyle habits.
So why did you call me pre-diabetic and now you're telling me things have changed?
Before a person becomes diabetic, we check blood sugars on them every 3 years. We are analyzing something in a person's blood that's called a hemoglobin A1C. There are certain levels of the A1C that mean different things in reference to diabetes. This is what a red blood cell of a non-diabetic A1C looks like. The blue dots represent glucose stuck to a person's hemoglobin contained within a red blood cell. When a person becomes diabetic, more sugars are found stuck to the hemoglobin cell. Because insulin now cannot force sugars to be used within the muscle cells, they circulate throughout the bloodstream more readily.
What do you mean? There's more than one different level of hemoglobin A1C?
Yes, there are certain levels of A1Cs that we take a look at when we draw your labs. An A1C is a percentage of the amount of sugar stuck to your hemoglobin over about 3 months' time. When your average fasting blood sugar is less than 100, your body has the ability to use food for energy and is functioning normally. You become pre-diabetic when your blood sugar stays elevated between 125 to 150 for a long period of time, and your A1C is between 5.5 and 6.5%. When your fasting blood sugar stays greater than 130 and your A1C stays above 6.5%, you are then considered to be a diabetic. This chart represents the relationship between blood sugars and hemoglobin A1C. When your blood sugars are normal and between 68 and 126, your hemoglobin A1C is between 4 and 6%. This represents a person who is not a diabetic. When a person has blood sugars that linger between 127 and 153, the A1C is 7%, and we consider this pre-diabetic, which is where you were 3 months ago, Bill. Now your hemoglobin A1C today was above 7.5. This means we need to talk about treatments and complications for diabetes.
Oh no, this doesn't mean I'm going to start losing my toes and hands, does it?
There are certain things we can do to prevent complications. Complications of diabetes include things like blurred vision or blindness, wounds on your body that have a hard time healing, nerve problems that can cause a lot of pain, heart disease, a stroke, vascular disease in your extremities that do not allow good nutrients to get to your tissues, and also your kidneys could stop functioning properly.
Whoa, how do I prevent these things from happening to me?
The first things we can do to prevent these complications, Bill, are lifestyle modifications like we've already tried. Those modifications include weight loss, eating a healthy diet, smoking cessation, limiting your alcohol intake, and getting at least 30 minutes of aerobic exercise 5 times per week.
Well, it's just not easy to do those things.
Bill, we should start treatment according to guidelines published by the American Diabetes Association and the American Academy of Endocrinologists. Your target hemoglobin A1C must be less than 7%. This means that your before meal glucose must be less than 130 and your post meal glucose must be less than 180. So for you, your target A1C is less than 7, more specifically between 6 and 6.5% because you are a young, healthy man. As you get older and your body becomes more complicated, your hemoglobin A1C target is between 7.5 and 8%.
Gosh, does this mean I have to give myself insulin shots every day?
No, you won't give yourself insulin this early in treatment. As a matter of fact, insulin is a later treatment in diabetes to prevent complications. If you don't have any signs of symptoms or complications, we would start talking about insulin when your hemoglobin A1C becomes 9. However, the American Association of Endocrinology suggests we start with monotherapy. This would mean you would start taking a medication by mouth that's called metformin.
You mean I have to take medication for the rest of my life?
At this point, you are considered to be diabetic, and we will need to watch you very closely. Yes, that may mean you have to take medications for the rest of your life, at least until you have your sugar under control, and you will come see me in the office at least every 3 months. You are going to start taking a medication called metformin. It is considered a biguanide, which is a medication that increases tissue sensitivity in your muscles to insulin, and it decreases the amount of sugars released from your liver. If taken correctly, the potential could be a drop in your A1C percentage of up to 3%. At this point, your beta cells in your pancreas are still making insulin. Metformin will help your tissues suck up those sugars and use them for energy. So, I will send you in a prescription today for metformin. You will take this medication twice a day. You will start taking 250 milligrams in the morning, and then you will take 250 milligrams again at night. In the meantime, I still want you to get your exercise, quit smoking, drink plenty of water, and watch your diet. This means, if it's okay with you, I'm going to also have you see the dietitian again.
Will this medication make me feel sick?
Some side effects of metformin include an upset stomach, weight loss, and diarrhea. We also need to talk about signs and symptoms of high and low blood sugars.
So, can my blood sugar still get high and low while I'm on this medication?
Yes, there are several signs and symptoms you need to watch out for. They can be a little different for everyone, so you may need to get to know yourself. They may start when your blood sugars are 50 or less. Some of the signs and symptoms you may have at this point will be headache, hunger, difficulty concentrating, sweating, shaking, irritability, and mood changes. It is important to keep proteins or sugar close by until you get to know yourself really well. There are a couple things you can do to help yourself from getting too low. These include having a snack before you exercise, avoid simple carbohydrates or beverages with large amounts of sugar, eat a high-protein diet, and small frequent meals. If your sugar does get too low, I want you to take 15 grams of carbohydrates at the onset of your symptoms, followed by a complex carbohydrate after your sugar is controlled.
So, you mean if my sugar gets too low, I should take 3 glucose tablets and drink some milk?
Yes, Bill, that's correct.
But how do I know if my sugar gets too high?
There are signs and symptoms for high blood sugar, and if your sugar gets too high, you could experience a dangerous condition that's called diabetic ketoacidosis. If this happens, you will have to urinate a lot, your skin will be dry, you will be very hungry, and your vision can get pretty blurry. You will also feel really lethargic. At the beginning of these signs and symptoms, check your glucose and make sure you do not get out of control. If your sugars stay too high and you begin to have the signs and symptoms we talked about, you need to go to the emergency room immediately.
Okay, I think I understand. If I'm cold and clammy, I need some candy. And if I'm hot and dry, my sugar is too high.
Absolutely, you got it.
So, what happens if I become a lazy guy or get depressed and I get these complications you talk about because I don't take my medications or watch my diet or start to exercise again?
Bill, I don't mean to scare you, but we do need to speak frankly and clearly about this. There are several long-term complications of uncontrolled diabetes. Over time, this can cause problems with your body functions and your organs, such as your kidneys, nerves, feet, and eyes. Having diabetes can also put you at a higher risk for heart disease and bone and joint disorders. You could lose your eyesight, you may experience numbness and tingling in your legs, you may get sores on your feet that do not heal, your kidneys could stop functioning properly, and with heart disease, you may have circulation problems and end up with amputations.
Okay. I will monitor my sugar levels, try to exercise, watch my diet, stop smoking, and take my metformin. So this way I can be sure I don't lose my limbs.
Well, it's important that we set goals that are obtainable and realistic. We will continue to work on lifestyle modifications. Like I said before, you will be making frequent visits to my office until your sugars are under control, which is a hemoglobin A1C under 7. Right now we are going to draw some labs, and I will send the script for metformin over to your pharmacy along with a script for a meter and some strips. I want you to check your sugars a couple times a week, log those numbers, and bring that log and your meter back to the office with you on your next visit. I will see you in 3 months like we discussed before.
More labs?
Yes, more labs. You don't want to lose your limbs, right? So today we're going to draw another hemoglobin A1C, a CMP for BUN and creatinine, and a fasting lipid profile. I also am going to ask you for a urine sample to look for proteins, glucose, and ketones in your urine. We need to watch your kidneys closely as well.
Well, might as well get used to this.
Our next step in your treatment may mean either stopping the metformin if your A1C levels fall or increasing your metformin dose next visit.
What if increasing the metformin doesn't work? Then what?
Then we will start a medication known as glipizide. We will add this to your regimen. It's known as a sulfonylurea. The job of this medication is to stimulate insulin secretion in the beta cells inside your liver.
And if that doesn't work, then what?
At that point, Bill, we will still be seeing each other every 3 months. Here we will talk about starting an insulin that's called a basal insulin. This type of insulin you will start taking only at bedtime, and its job is to bring your fasting blood glucose down. If we start insulin, we will slowly back off of the glipizide. That insulin doesn't control you, then we can talk about the many other types of insulin to include bolus insulins that are short-acting and they target your mealtime blood sugars.
Alright then, I guess I'll head over to the lab and then stop by the pharmacy to get my meds.
Okay, Bill. See you in 3 months.
No, I will see you in 3 months, 'cause I'm gonna control my sugars and not lose my eyesight. Wink, wink.